about anything you can think of outside's out there. It's a great, great place to be.
You don't have the hustle and bustle of a big city, but it's not so small that there aren't opportunities.
It's just a more peaceful place to live.
There's more opportunities here than a lot of other areas.
It's a great area to live in and work in. Came to this community, I got settled in. I joined the YMCA. I was trying to be active in the community. I met my wife, and the rest was history. We just been here ever since, and we don't plan on leaving. The cost of living is certainly a little bit less up in this area. I think people are afraid of the longer winters, but the winters are really, growing up in Albany and living in Boston for the majority of my life in those two places, other than here, the winters are really not much different. I think it's a lot of it is just, the folklore of this area. It's a growing community because of Fort Drum being here. And Fort Drum continues to expand.
With veterans, there are any number of areas that could use qualified health professionals. Also, we have a number of different kinds of agencies. They are hospital-based agencies, residential agencies, agencies that work with children, outpatient, and so on. So it's been a consistent need. It's a difficult need to fill sometimes, and it also involves all levels of mental health qualifications, including entry-level positions. So even people who come out of college with a 2-year degree, there's a place for them to work in the mental hygiene profession. All the way up to people with, obviously, with psychiatrists or licensed psychologists, licensed social workers. There's a need across the board, and that's been pretty consistent for several years now.
When you're in a more populated region, there tend to be less jobs, or the jobs are more likely to go to someone who already has a license. And since I was just finishing up grad school and was not licensed, this was an opportunity to have a job and to receive the supervision that I need. And that was one of the big differences from the other places that I've lived.
I'd say there's more opportunity here than I've seen in a long time in a lot of places. One of the things I've come across, having been in the medical field and now psychology since I was 17, is that these kind of positions in mental health and medical fields are pretty recession resistant. You don't have a lot of nurses and doctors being laid off during a recession. Hospitals don't close down.
There's a quality of life here. And I've lived in cities, and my husband grew up in a city, and we have chosen to be in a place where you just don't have to worry about all that stuff going on at once, that it's just a more peaceful place to live.
I'm originally from Long Island. I've been up here for quite a while. We moved up here in like '95. My husband got a job up here working for the prisons, so that's how we ended up here. And I was pretty resistant to it at first, but once I got used to it, I really liked it a lot. It is a slower pace, and now whenever I drive down to the city, I get annoyed. I mean, you can drive to work without dealing with, rush hour traffic and all of that.
I work with active duty soldiers and some family members, but primarily the active duty soldiers during the pre and post deployment. When I came up here in 2004, that was part of the reason why I chose this location, because I knew Fort Drum had a high deployment rate and that these service members were going to be in need of mental health services upon return.
There's so many different resources to get a job here, and people that are willing to help. And like I said, it's so community-based. They know if they can't get people to fill their positions, then they'll have to close their doors. So a lot of people are putting forth the effort.
Once I get somebody in the door and they've been here for a few months, the vast majority, overwhelming majority, want to stay here.
As in a small town, environment, we are able to get into things a little bit more. We can wear more brims on our hat, if you will, than if we were in a big city, where we might have to specialize in something and then stick specifically to that. But here, it's kind of like a smorgasbord of issues at family counseling that we can work with. And I think that that offers any provider coming to the community something to welcome.
A lot of people who are discharged from the military, from Fort Drum, choose to live in this part of the country, even though they've been all over the world.
More than 8 years ago, I moved here when my husband was a soldier on Fort Drum. And once he got out of the military, we decided to stay in the area. I was already working in the community and had a really good job, a job that I liked. I was also working in human services at a different agency. And the North Country really became our home.
You can't get bored here. Unlike, say, my private practice was heading down that road of I've been there, done that for too long. And up here, it's a new challenge. And people are needy for all sorts of services, and it's nice to be able to try to provide them.
There are options with schools, there are private schools as well as the public schools. It's a great place to raise a family and feel safe, and yet there are opportunities. I'd say to give us a shot, because I think it's a good place to be.